morning, everyone. Good afternoon, good evening, dependent on where everyone is coming from today. Welcome to another great week of the Global Cafe sessions. As Berenice mentioned, my name is Roxana, and I'm super excited to be discussing today's Global Cafe with you all. But prior to introducing our incredible speaker, I would just like to inform you all that unfortunately Ms. Nancy Hoden was not able to join us due to an emergency. However, we will most definitely be sure to have her back in the new year for a cafe session. But we have Ms. Melissa Gong Mitchell, who has graciously stepped in very last minute, might I add. So thank you so much, Melissa, and a special thank you to Dr. Cynthia Stewart as well, for facilitating this introduction with Melissa today. So to give everyone a little bit of background of our incredible speaker, Melissa is really the executive director of the Global Coalition on Aging, the leading business voice on aging policy and strategy aimed at reshaping how global leaders approach and prepare for the 21st century's profound shift in population aging. In her role, Melissa is responsible for the operations and management of the coalition, internal and external communication strategies, member and stakeholder outreach and development, including fostering relationships and aligning partners across industries such as, the NGO community, advocacy organizations, governments, and global institutions. She is a member of the Professions Working Group that advises the Age-Friendly New York City Commission and has previously served as a member of the Benefit Committee on the Skin Cancer Foundation. Melissa is a senior managing director at High Lantern Group, and her 15 years of public affairs experience includes specialties in policy-related and CEO-level strategic communications, advocacy campaigns, and coalition building. It's truly very lovely to have you with us today, Melissa. And again, thank you very much for your time. Now, I would really love to hand the floor over to you, Melissa. At the Global Cafes, we like to first start off way at the beginning with our speakers. So I'm quite curious to learn about you and your journey, both professionally and personally, leading you to where you are now with the Global Coalition on Aging.
Well, thank you so much, Roxana, and thank you so much to IFA and the Global Cafe for inviting me to come. I think it was kind of serendipity that Cynthia was with us this week at Silver Economy Forum, and she invited me to come yesterday, and I couldn't say no because it was a wonderful opportunity. And Nancy just sent her regrets. She hopes that she'll be able to join you all soon. And I love all the work that you are doing here and opening up these conversations. So I'd love to invite questions and chat with folks about Silver Economy Forum and other topics. So I have been executive director of Global Coalition on Aging for about 13 years now. We kind of officially launched in 2010. And as you read from my bio, Roxana, my background is really in public affairs. I did public affairs work and advocacy work here in the United States, where I am based, for about 10 years for a different industry. I actually started in the travel industry, and there it was really all about how do we change hearts and minds, particularly from a policymaker point of view, about why our issues were important and why government leaders needed to pay attention to those issues. And so when I decided to make a transition in my career, had lots of different conversations about, how could I use a skill set that was really focused on strategic communications, how you engage stakeholder audiences in the right way, and how you bring coalitions together. And so that coalition building piece was really important. But as you also said, Global Coalition on Aging, we really are a business voice. And so working with the business community and bringing a business voice into topics and understanding how businesses operate was really interesting to me at that time of a transition. And so At that moment, I had the great opportunity to meet Mike Hoden. And my boss now, the CEO of the Global Coalition on Aging, and he kind of brought this idea to me that, population aging is the global mega trend of our time. And we don't have enough positive attention on it to say, what are the actions that can be taken to turn something that does look like a crisis, and remind you this is 13 years ago. How do we turn that into a positive, and how do we turn it into what are the changes that need to happen on a policy level and a practical level, so that we can take this idea of aging and this huge trend and see how we can make it positive. And then bringing the business voice to that was very important. But we understand that people can't work in silos, groups can't work in silos if we really are to make change. So when Mike discussed this trend with me and what he was interested in doing, and that he was interested in creating this coalition, I couldn't say no. I mean, it was kind of like doing this. It's kind of a no-brainer. It's like, absolutely. I mean, this is something that's going to affect all of us. And it's not just older people today. I mean, it's huge. We have to get it right for older people today. But this affects us for generations to come, as we know these demographic trends are built in for decades. And so, I started doing this work at the Global Coalition on Aging and had the opportunity to work with people who are just passionate about it. And as you get into this work, it's clear that particularly the business community, no one's job is specifically for aging or to advance aging topics or specifically on healthy aging. And so you really work with people who are passionate about it and people who understand that the aging topic is related to their work, whether it's in public relations or whether it is in human resources or whether it is in product development and marketing. And so that's what's really great about this too, because the people who work on it and that we engage with are truly passionate about it because they see the impact, the broad societal impacts, the business impacts, the personal impacts of this topic of aging. And like all of us, we're all aging, we all kind of see the personal impacts of aging in our own lives as well. And so the caregiving topic, of course, is something that I think is near and dear to all of our hearts. And we've talked about it, Silver Economy Forum. As our former First Lady, Rosalind Carter, said, there are four kinds of people in the world. Those who have had caregivers, those who do have caregivers, those who will need caregivers, and those who provide the care. And so caregiving is really important as well to think about it, because the shift in our aging society kind of demands that we all will be caregivers or need care at some point in time. So that's something that we all touch on. And so I faced, that temporarily for one of my family members, for a parent, over the past several years, and of seeing the impacts of friends and families of the caregiving trend, and how we incorporate that into what we call the silver economy is important as well. But I'll stop there to give the background on me and welcome other questions, and can talk a little bit more about the content from Silver Economy Forum.
No, thank you very much for that. And I think you gave a lot of really great reasons on even just what you said of shifting the narrative of what aging really is towards a positive kind of lens is quite important. But I'll get back to some of the questions I wrote down here based on your bio, but I'm quite interested, given that today's December 8th and yesterday, so from December 6th to the 8th, you actually finished the Silver Economy Forum. Can you share with us a little more about the forum, including its aim, intent, and really objectives, just so we're all a little bit more familiar with it?
Yeah, I can tell you a lot about Silver Economy Forum. Again, because the Global Coalition on Aging brings together business voices with NGOs, academics, global institutions, and governments, we do play kind of a unique role in this space. And actually, the idea of Silver Economy Forum started several years ago. We held the first Silver Economy Forum in 2019. And at that time, it was very clear, as I said, our members are global corporations who are interested in, passionate about making changes in their workplaces. And those those companies came to us, and they're cross-sector, so healthcare, to financial services, to technology, to home care. And to start, I mean, it goes across the board. So they came to us at that time and said, we've had lots of forums where we talk about aging issues. We had a lot of health, conferences where we talk about health and aging. We've never had a comprehensive place where we bring together business and government to really talk about solutions on this topic of the broader silver economy, and really looking at it through an economic lens as well. So if we do well for aging society today, how is that going to have a positive impact on the economy as well? And so we recognized we had to have sort of the business and government kind of coming together. And so we partnered actually with the Finnish government. And so with the Finnish Ministry of Health and Social Affairs, they led on this with us, and they brought in finance ministry, and they brought in the economic ministry. And we were able to hold the first ever Silver Economy Forum in Helsinki in 2019. And it really was, the first time it was talking about the big picture issues. We had, lots of different groups come in. We had the OECD participate, we had the World Bank participate, WHO, of course, and that is where WHO, because at the time, the Decade of Healthy Aging was an idea that was coming together and about to be launched, and before the UN took it on. And so that was able to be launched there as well, which was really wonderful. And so it was a moment to say, we're in a place where so much work needs to happen. We have to keep up the momentum, and we have to make sure we're not just talking about it. And an important thing that we always talk about, we have to make sure we're not just coming together to admire the problem and nod our heads and say, okay, yes, we agree there's an issue, and how do we tackle it? And so our goal was always to take the momentum from that first Silver Economy Forum and kind of create, annual ways for us to come together and discuss a lot of the issues. Of course, COVID happened, and so we didn't have the chance to bring people together, because in Helsinki we had about 600 people in person, and there was just, we saw activities coming out of it. We saw partnerships coming together. And again, it was kind of cross-sector, cross-discipline. And so, it's quite a shame that we couldn't kind of keep up the momentum over the course of COVID, even though we did have some virtual events. So last year, we knew, travel policies, everyone wasn't completely traveling, but we had to have it. It was just at a moment, particularly COVID, where it really just highlighted sort of some of the challenges faced with ageism in our society, with older people being left behind. Like, how can we make sure that we're continuing to bolster these issues around healthy aging for the benefits of the silver economy? So last year we actually did hold Silver Economy Forum, but we did it in 3 different cities, 4 locations, and we did it over 2 days. So it was quite ambitious, but we knew with the audiences and kind of the work that was happening, it was really important to do that. So we were in Dublin, as you all probably know, with Ireland being the first age-friendly country. We did it in Geneva because the location, and we had WHO officials with us, and others from global institutions participate. We were in New York with the World Economic Forum as well, and also at the UN headquarters to make sure that we were speaking with the various permanent missions who are really focused on this issue as well. That really gave us a sense of, okay, people are back into this. We're back into meeting in person. We're back into coming together, having side meetings on the margins of silver economy, really making, action happen. And it only happens kind of when we come together. Again, we can all sit at our desks. I mean, we can all work in our silos, and we can all sort of do the things that our job descriptions say we have to do. But if we don't come together and figure out how to be creative and how to be innovative and work together, we're really not going to be able to solve the problem. We'll continue to admire the problem. So with Silver Economy Forum this year, we held it in New York City. Our Global Coalition on Aging is based in New York City. Clearly, the UN is right there, and a lot of our partners are there as well. And so working with our member companies and so many other partners. So I think we put the agenda for Silver Economy Forum in the chat, but there's also, you'll see a sponsors page, but it's so much more than the sponsors. It is the incredible collaborating partners who we had as part of this to make it happen. So, from Business Council for International Understanding to Economist Impact, who came in as a partner on this. Of course, it's a contribution to the decade of healthy aging, and many other organizations to be part of this. We saw that we're kind of at a groundswell of interest and of action. And so with Silver Economy Forum this year, our goal really was to say, how do we highlight that aging is universal, it's for everyone. So if we look at the aging topic and we say, okay, if we zoom out on it, we've got this global economy that is fueled by more older people in society than young, soon to have 2 billion people over the age of 60. We have to build the economy on that concept and know where the spending power is, et cetera. And then when we think about it from a more individual and personal level, all of us have a stake in this, regardless of what your age is, where you live, what your economic status is. Aging is an important topic, not just about the older generation. And so we really wanted to be this to be about aging for all ages. And because when we think about aging, it's about our grandparents and our parents and us for generations to come, but it's really for our children. We have to get it right if we're going to change policies, if we're going to adapt structures that were created in a time where people weren't expected to live past traditional retirement age. It really is about our children. And if young children today have a 50% chance to living to be over 100 years old, we kind of have to change the way we think about this trajectory of life. And that has to start with us, helping our children understand. And it is kind of breaking with the stereotypes of what it is to be older, what retirement looks like, if retirement really needs to be in existence, it's a mandatory kind of thing. What does that look like? And so we're seeing a lot of those changes happen. So that's why we brought Silver Economy Forum together this year. It really was about aging for all ages. And I can go into some of the content and welcome, Cynthia to chime in, or if anyone else had a chance to watch virtually or be with us in New York, I'd love to hear your thoughts as well.
Thanks very much. And I open folks to please put some questions and comments in the chat. I saw some comments actually, Melissa, reflect how excellent the forum was. But shifting back to some questions for you, as part of one of the many outcomes of the forum this year included really the launch of the WISE Council, so the Women in Silver Economy Council. I understand that the council was established to both recognize and also prioritize that aging is a women's issue. So can you share with us a little what that means, what WISE really is, its focus, and some policy changes that need to happen as part of the WISE Council's mandate?
Yes, and I see the comments in the chat and the questions as well. So we will certainly address those. And thank you for those who attended. I love seeing the comments. It makes me feel that we did a good job. So WISE Council is something that definitely very passionate for me. So WISE stands for Women in the Silver Economy. So as I've been doing this work with Global Coalition on Aging for 13 years now, we try to find where our priorities, because we have a lot of priorities. We're focused on a lot of different issues, and a lot in the health space, finance space, caregiving. But as we do all of this, and as we convene people, as we produce white papers overall within the Global Coalition on Aging, and as we hear the conversation bubble up at Silver Economy Forum and other places over the years, one issue that in our minds just kind of didn't get enough attention is aging as a women's issue. Aging is most definitely a women's issue, and we haven't been tackling it like that. We see clearly a lot of activity, I think, happening in the space of women's health and women's leadership, but it hasn't really come together in a way where it focuses on women and aging. And so we have been working on WISE Council and launching WISE Council at Silver Economy Forum, really with the concept that aging is a women issue. We know women live longer. Women face higher prevalence of chronic conditions like cardiovascular disease, cancer, osteoporosis, Alzheimer's disease. Women earn lower lifetime income. Women are the primary caregivers. They spend more on caregiving. They go in and out of the workforce for caregiving more often for children and for older loved ones. Women have higher healthcare costs. So women, as we carry on the higher caregiving burdens, and sort of face these challenges on the health side, on the finance side, and yet expected to continue to be drivers of the economy and therefore drivers of the silver economy, it kind of doesn't add up. Like it's almost just this pressure is coming down on women, and yet we're expected to continue to accelerate and move forward as women are making most of the purchasing decisions, chief medical officers of their family, making the healthcare decisions for their family as well. So again, the equation doesn't add up. So how can we be a catalyst for creating change to recognize that women are drivers of the silver economy? And then when you combine that with kind of what's happening in the workplace, and we recognize that women, of course, over the past decades have faced a fundamental sexism in the workplace, and going back 30, 40 years, the women who were fighting for childcare benefits in the workplace are now the same women who have advanced in their career and are facing ageism in the workplace. And they're at the point in their career where they're having the caregiving responsibilities for their aging loved ones. They are dealing with the impacts of menopause, which is just a phase. It's an entire phase. It's not an illness. It's a phase that takes place over time, and it makes the challenges of work also when it all comes together. The leadership issues, the health or menopause issues, and the caregiving issues all coming together. So again, these are all challenges, and so we wanted to point out that these are challenges. They're unfair, and we can create an environment, we can create a world, we can create workplaces in which it doesn't have to be that way, in which we can make sure that women are able to excel and again continue to drive growth in the silver economy. And as we say with caregivers, women typically are much more taking care of everyone else, getting the job done, taking care of the children, making sure mom and dad are okay. And they often don't spend enough time focusing on themselves and their own self-care. And we need women to be healthy if we want women to drive the silver economy. And so that's why we've created the WISE Council. So we've pulled together some amazing women. And on our panel yesterday, Lorna Sabia from Bank of America, who runs retirement, they're so passionate about this. They do so much work in the space of caregiving. They've done a menopause study recently. This is a financial services organization. We had a representative from Bayer, passionate about women's health. And the topic on women's health is how do we also look at, it's not just menopause, it's how women are making decisions and health decisions over the course of their lifetime. And we also know women are discriminated against in healthcare. Women's issues aren't always paid attention to. And we also see that with older people. Older people's issues in healthcare are not always paid attention to. They could often be brushed off as just, you're just getting older. Those symptoms really aren't anything. We get the same as women in the healthcare system. And also because women aren't studied in clinical trials. In the United States, 1983 mandated that women and minorities were to be part of clinical trials. And we still haven't made that much progress 30 years later. And so the baseline in healthcare is like an average size man. That does not help in ensuring that we can get the best healthcare possible. So then also in the panel, we had the representative from the Bone Health and Osteoporosis Foundation, who also runs the National Menopause Foundation here in the United States, because we recognize that menopause and bone health really come together. And when we talk about chronic conditions, particularly those that disproportionately affect women, osteoporosis is really important. Fragility fractures, an incredibly important issue. If you have it takes 3 fractures before someone is diagnosed with osteoporosis on average. And if you have a fracture, that most certainly indicates osteoporosis, and yet women in particular are not getting the attention on that. I'm actually a testament to that because I fractured my back earlier this year, and I'm still trying to push my medical professionals to get a DEXA scan because they say you're of a certain age and so you should be okay. I said I fractured my back. If I fell and I had a fracture, I need to make sure that I'm doing what I need to do to make sure I don't fall and have another fracture. And so these kinds of issues to also help women be more empowered on their own healthcare, know what they need to do, and not just say, okay, the healthcare system knows what's good enough for me, because that's just not the case. That's really important for us as well. Women's health is an important piece of that. And then yesterday, sorry, on our panel, I'm going in lots of different directions. We had a representative for Major League Soccer who works on consumer products and has been in the sports and entertainment business for all of her life. And she is recognizing, as she is progressing within her career, that her field needs to really be thinking about how they continue to grow women as they age in the profession, but also leveraging something like sports, to be able to be a unifier around that. So we had an incredible panel. So if you go to that agenda page that we put in the chat, you'll see all the panels, and the women's panel is there. And so we had a really wonderful conversation about what do we need to do. So there's certainly policy changes that we identified, and we're going to develop this into a broader agenda that will launch in 2024. But policy changes on healthcare is certainly around what I just talked about. Fractures is a really important piece. It is around prevention. It is around benefits in the workplace for these types of things, for preventive medicine, for things like DEXA scans, and also from a finance point of view, to ensure that women can and do save. So what are some of those mechanisms that can be provided so that we ensure that women are putting away money so that they can have them for their ongoing cost in the future? And then it's just changing the dialogue and making sure that we're having these conversations amongst women, but amongst a broader community. We want to bring we're admitted to the conversation as well, but we really want to start where it's happening, which is why I wanted to have the conversation with women in senior leadership positions. And we don't want it just to be just business. We want it to reach out to advocacy groups, of course, and to government leaders or former government leaders, those who have been there and have seen, where does this glass ceiling, which I'm seeing this double glass ceiling now, that kind of puts sexism down on us in the workplace, but also ageism that comes a little bit later. It's just pushing down on us. How do we break through that? So we need to have a conversation around that. So that's what we're aiming to do: build the conversation, build the policy and workplace priorities, create an agenda around that, and then pursue that together.
Thank you very much, Melissa. And that's just absolutely wonderful. Thank you for that and what you guys do. And I think one of the points that we discussed yesterday was the importance of equity and inclusion, which aligns with what you just said with the WISE Council. But can you maybe elaborate more on what you meant by the importance of equity and inclusion, and how specifically the Silver Economy Forum focuses on both inclusion and equity as part of the narrative of healthy, but not only healthy, successful aging? And I think, if you don't mind, I can also tie this a little with another question in the chat from Mr. Shmuel Yerushalmi, who's first of all, he's a fantastic every week cafe attendee, but his question was in regards to how the forum can potentially support the social and economic well-being of older adults, looking at populations in varying socioeconomic groups or population, and specifically poor and lower income countries.
Yeah. It's a great question, and something that we think about all the time, because typically with Global Coalition on Aging, how we started out and how we thought about Silver Economy Forum, it is about changing the dialogue, kind of doing this top-down kind of approach. But we recognize that as we have progressed over the past several years in the dialogue at Silver Economy Forum and the work that we do at GCUA, we also have to have this bottom-up approach. And how do we impact people on the ground? And to be honest with you, that was not our first objective when we created Global Coalition on Aging. We really wanted the top-down approach. But we recognize we need both, and we realize we have a voice to be able to do both. And so when we look at issues around equity and inclusion, and we look at how we serve underserved populations. Most certainly, Global Coalition on Aging has dialogue across economies, with a lot of work, of course, in North America and in Asia and in Europe, but increasingly so in different areas around the world, in lower and middle income countries. We're still kind of coming on in that area, but we're having dialogues there. And then, but as we look at what we can do with the audiences and with the partners that we currently have, one of the things that was featured at Silver Economy Forum yesterday and on Wednesday is a project that we have going on serving underserved Americans. So when we look at what we're doing, and again, we're based in the US, even though we are global, but how do we serve communities where they are? How do we meet people where they are? And how do we ensure that everyone has the prospect of growing older? And so when we started a project with one of our member companies, Novartis, to look at cardiovascular health in different places across the United States. And we wanted to make an impact, like I said, on the ground in communities. So we looked at age-friendly city infrastructures, and we said, who has existing age-friendly infrastructures, but who also has an incredible need to improve their cardiovascular health? So we took the list of hundreds of age-friendly cities in the US, and then we started kind of boiling it down to say, where are the partners we could work with? Where's the big need? Because we wanted to have a program specifically on community health. We didn't know exactly what it was at the time. This is about a year and a half ago. And in those conversations with a lot of the national and global stakeholders around cardiovascular disease and aging and care, we came to Baltimore. Baltimore is such an interesting city for a number of different reasons, but not least because they have health disparities where you can live in one place and have a life expectancy of 85 years old and be white, and you can live across the street and have a life expectancy of 65 or less, and you're African American. This is not fair. This isn't right. There's no access. You look at the differences and just the zip codes, you have less access to healthcare. You don't have trust in the healthcare system. You have less access to healthy food. There's something wrong here. So we wanted to go in to see how we could be a catalyst in changing that. And we recognize there are a lot of community health programs that happen around the world, where organizations like ours or health systems come in and say, community, here's what you need. Now you should go and change your behaviors. We said, that's not what our model is. Our model is going to be, we're going to come into the community. We're going to provide you some resources and some information. You say what you need and you design it, and you get leaders from your community to implement it, and we'll support you in that. And so we're really, really fortunate that we have some incredible partners on this. And we met someone who I hope, Cynthia, you had a chance to meet, Pastor Terrace King, who is a pastor with Liberty Grace Church of God. He's a former Center for Medicare and Medicaid Services here in the United States, who knows how the government works, and he's made change through his government work. And yet I think he's most excited about this program. We recognize that in the church communities, that is where people listen to their peers. People come to gather. People come to learn. And so by working with the church community, we created a program in which we have community health ambassadors. So these are individuals who are in their community. They're not necessarily social workers. They don't have to have a background in healthcare. The most important thing is they need to know their community and be trusted by their community members. And then they're the ones that are encouraging people to come in and take part in the program. So we developed a program that has 3 different pieces: information and education. So bite-sized information in the way people can understand what are the different types of cardiovascular disease, what are the risk factors, what are the family history that should get me to think about this, and then screenings. Now we actually have Johns Hopkins Nursing School come in to do the screening so that people can understand, what do these numbers mean? what should I be watching for? What should I be asking my healthcare provider? If I don't have a primary care physician, can you help me get a primary care physician? How does Medicare or Medicaid work? Can you help us with that? And then healthy food is the third component, which is most exciting because we're partnering with an organization called the Black Church Food Security Network. It's an organization of a pastor who kind of retired as a pastor because he was passionate about making sure he got healthy food to the Black community, particularly in Baltimore, but all along the Eastern Seaboard. And this is with the idea that access to healthy food, grocery stores leaving certain neighborhoods or decisions that they make that are made. And so it's been very apparent in the conversations with folks in Baltimore that we can say food deserts and we can say, oh, there's not healthy food accessible. And that's the core of the problem. But it's not food deserts. Deserts implies that it's naturally occurring. They call it food apartheid because purposefully healthy food is being taken out of these neighborhoods. Again, this is completely unfair and unreasonable. So we are working with organizations like Black Church Food Security Network to bring healthy food in. And this is not about giveaways. This is not about bringing in, because there are plenty of those situations where there's government subsidized boxes of food, right, that are given away. This is not what we're doing. We are bringing in the healthy food. We're teaching people about the healthy food. We're working with the culinary ministries within the churches and other chef experts to create recipes and meals that use these healthy, locally sourced and mostly Black farmer sourced produce to create healthy meals that are also true to the culture of this community. It's not about saying, again, here's something great that worked over here and now you should eat it. It's something that is tied into the culture of those communities. And so we're really working to change hearts and minds and kind of taste in terms of making sure people get access to the healthy food, and that's benefiting those farmers as well. And hopefully that creates this ground surge to make sure that people are not only just sort of like getting food and saying like, what do I do with this, but seeing how to use it, and then also purchasing it themselves. We want to change behaviors again so that people can make those healthy decisions for themselves, and they're getting the best food, not just, you know, the leftover vegetables that are misshapen or whatever it is that happens sometimes with those giveaway boxes. But so we're also making sure that they get access to the best foods. So this program is just one example about how we're trying to bridge some of the challenges when you look at social determinants of health. How can we be a catalyst in that? And we're hoping we can scale this model in many different places around not only the country, but around the world. We're actually talking with a partner coming out of Silver Economy Forum in Germany to say, ooh, how can we take this model and use this playbook to make sure that we're bridging some of the gaps there as well. So hopefully we can grow this. That was a long answer, but I'm really passionate about it, as you can tell.
No, that was perfect. And thank you, Melissa, and thank you, Shmuel, very much for that question. I also just want to turn to Mr. Dan Levitt in the chat, who posed a question about our opportunities working with different sectors. So Dan, may I please ask you to unmute to pose your question to Melissa?
Thank you. This is a very interesting conversation. And Melissa, thanks for all the work that you're doing in this sector and giving us that kind of that broad perspective of what's happening. I also put in a piece I wrote about this. I'm not being an expert in this area, but certainly I'm very interested in it. So I am curious about the whole area around marketing and about the silver economy, and specifically why companies that target youth don't target a market that is bigger, and especially people like me who are, I'm a runner, and I don't see myself being represented in Nike or Brooks or Adidas. When I look online and look at products or going to the stores, we do see it once in a while. We'll see a Vogue cover magazine with 106-year-olds in the Philippines, or with Judi Dench, or once in a while we'll see products. I can think of some companies that will actually advertise with older people, but I'm wondering how do we change that and encourage companies? I wonder if there's an opportunity there, or if that's something that is happening and I'm missing, or where's the opportunity for us to kind of really emphasize that market piece. And again, I know the silver economy is beyond just the market. So I'll leave it there. And I know, Melissa, I'd love to hear from you and others where the opportunities lie.
Well, there are lots of opportunities, and I think that's the right question. And that's one where we really have been trying to continually, beat the drum on this to say, this is a huge market segment. And clearly everyone over the age of 60 or 50 or whatever you choose, it's not the same. You've got a lot of different varying tastes and opportunities to market to that. So there actually was a really interesting conversation yesterday, not yesterday, 2 days ago at Silver Economy Forum. Actually, there were a couple. There's one, if you look at the agenda page, there's one called The New Joy, which was really great, and one called Who's Investing. So I can point to what some of these folks said, because I'm not the expert in this. I'm just trying to help kind of lead the conversation in this. But within those conversations, really interesting, because there was someone from the beauty industry, Ron Robinson, who's the CEO of a company called Beauty Stat. And he, after being in the beauty industry for decades, recognized that there's this huge opportunity for older women in the beauty marketplace. And so he created products that are specifically for older women. So it's great. And he's doing a wonderful job. But what's interesting, when we met him, I went to his website and he had a whole category of anti-aging products. And I was actually talking to Nancy about this. And I said, that's not what we're doing. We're not trying to stop aging. We're not against aging. We love aging. We want to embrace aging. And so we talked to him about it. Actually, Nancy talked to him and said, it's not anti-aging. And so, and he got that. And he said, oh, I get that. And if you go to his website now, it doesn't say, there's not a category anti-aging anymore. I think he changed it to like age rejuvenation or something like that. But it's changing those ideas about what it is we're trying to do, who we are trying to reach, right? And the problem is, when you're looking at marketing in this is another speaker we had. I encourage you to check out Michael Tamblin, who's the CEO of Rakuten Kobo. So I know Rakuten because I buy a lot of things through Rakuten. Rakuten Kobo is e-readers. That is more of a global product. He's the CEO, and he said they had the data. They had a data that showed that like consumers are older, consumers are going to read books, consumers should be interested in our product. And yet his marketing team was all like, no, but you want to look at this like 18 to 35 demographic. And he said, no, we need to be looking at the older demographic. And I mean, the core of what he said, and that's what we all gathered from this, is that basically that whole marketing team was out. He brought in a new marketing team to say, let's look at this real opportunity, and their business is thriving because of it. We don't have enough of those examples where we're seeing that change in terms of, oh, the bright, shiny thing is the younger demographic, because younger demographics don't have as much spending power. Younger demographics are going to change their minds a lot. But if you get someone in their 50s or 60s or even their 70s, you can have them for 30, 40 more years as a consumer, and they're going to kind of be more loyal to your brand as well. So I think they're a company that's really getting it, and we need to see a lot more of that. And then I think in like sports, entertainment, media, we're getting there. We're kind of moving towards that. And I think, and I hope you're able to get Nancy again, because I think what the perceptions are of older people in the mass media is just really important, because that's going to have to help, shape how we kind of change the world. I mean, it's not a small task, but we're seeing more in that space. That's why I was really enlightened that Major League Soccer came to the table for Silver Economy Forum. We had someone from an organization called One Community, and they work on helping in the production of films that focus on stories of older people as active people, not as disabled and dependent. And so we want to see more of that, because we're seeing that more from a how do we change the social dialogue as well? So I think your question is right, Dan. Like we're not there. We're certainly not there. But what was really exciting about Silver Economy Forum is that we've actually made more progress than I think we knew. And I think the next step is we want to make sure that we're sharing that progress, and we're hoping we can build on that to say this is a really attractive space and it's exciting. And actually coming out of the forum on Tuesday, one of the participants who was kind of new to the space, but we were kind of working on some other things with, said, this kind of gets me excited about getting older now, because there is so much opportunity here. So that's kind of what we want to do in terms of changing hearts and minds and then changing behaviors.
Well, thanks both. And thank you so much, Dan, for that great question. Next, I want to turn to Cynthia. So you have a question in the chat about intergenerational work. Would you like to unmute to pose your question to Melissa?
Yes, thank you. As you were just talking and responding to Dan's question, it really plays well on this one. And I am concerned, and it's also a bit of deja vu. I'm a baby boomer in the US, which means there was this period about when our Social Security system was, going bankrupt. And there was a horrible cover on one of our major weekly news magazines that had a pyramid, and it was an inverted pyramid. And you had all these old people on the top and just a few young people on the bottom trying to support that older boomer generation. And it did so much damage to the social psyche of the burden aspect rather than the contribution aspect of older persons to the economy. But I see it rearing its head again. Just in this past year, not but many months ago, the New Yorker magazine showed a picture of leadership in our Congress with walkers and wheelchairs and et cetera. I said, oh my gosh, we haven't come very far. This is still what media is continuing to portray. And in our own US elections upcoming, we have two very elderly men running for office, but one of them particularly is it's like the first words out of their mouth. My concern is the backlash what I referred to from the boomer generation to the current. I see it also in some of the climate change concerns. There's the younger generation is very, involved. Well, so are older people, but in fairness, the older generation got us in the problem where we are and not acting fair. But there are many of us in the older generation who want to solve the climate change problem also. So what, from your perspective, do you offer around working intergenerationally to avoid the backlash that I foresee?
Yes, Cindy, it's a huge challenge. And I do worry about this election season and seeing, all this talk about the gerontocracy, which is a problem. And we touch on this a bit in terms of how do we battle this. And I think you're right. The solution is making sure we have more multi-generational workplaces and people understand and can relate intergenerationally and understand that multi-generational teams are more productive. But when we're looking at kind of leadership and what's currently in the spotlight, particularly in the United States around older candidates and politics, we're kind of mixing a couple of things, right? Because it's politics, people who've been in are people, corrupt in politics, all of that. So they're kind of different things, and we're mixing those with age. And I think that's the challenge, is we're saying, is we're conflating these things, right? And so it's not simply because certain candidates are older, but it's because there's a certain experience within the political environment. I think that is really the challenge. We also have to understand there's a difference between age and capability, whether that's cognitive or physical capability. And that's where we still haven't been able to unthread that within our society. Anytime, age is coupled with cognitive decline. And we know that doesn't have to be the case. That isn't the case. Those are separate things. And where it may be more prevalent in older people, in many cases, it is not an automatic connection between those two things. And that is where I think we all do have a responsibility as leaders in this space and as advocates in this space to help make those distinctions. I wish I could say we could solve this before our election next year, but I don't think we're going to be there. But hopefully we can help get some attention to, because it's certainly divisive in the wrong ways. It's not about pitting generations against each other. So the more we can support this idea of multi-generational workforces, and also understand, the challenges with where we have gaps in the workforce, with not as many younger people coming into the workforce, we have to supplement that with older people as well, because we just don't have. I mean, the pyramid means something at some level, because there are fewer younger people coming in, but we supplement that with older people who are 100%, 110% capable of carrying out those roles. So it is, yeah, it's certainly a challenge, and it's a perception issue, and it's the inherent ageism that we have in our society. But I think we're making strides. I mean, this isn't something that can happen overnight, but I've seen progress over the past several years, and Cynthia, I hope you've seen it too. And let's keep working on it together.
No, thank you both very much. Thanks. And thanks everyone for the comments in the chat as well. I very much greatly appreciate. I know Jane Teasdale put a few comments in, as well as Amy Lipka, and we are slowly coming close to the hour, but I'm hoping to fit one quick question in with you, Melissa, and this is on the topic of policies, really. So as you've mentioned throughout the whole discussion, there's a wide array of interlinked but different strands that the Silver Economy Forum really hosts. And together these can improve the quality of life and inclusion in society and involvement in economic activities of the aging population. But I'm quite interested to know which policies or what policy changes you really want to see, if you have one specific in mind or one that you feel like we should be pursuing more.
Oh my goodness, one policy change. That's a really tough question, because I'd have to stretch across, all the different areas that we're working in. You stopped me there, Roxana. There's so many policy changes that need to happen. I mean, I think we need to have, of course, changes that enable women in the workforce, that also make sure we're focused on preventive healthcare. I think the prevention piece, because there's so many different policies that would be engaged in that, but how we shape, maybe that's the biggest and hardest one, how we reshape our healthcare system to be incentivized in a way that focuses on prevention with the pursuit of healthy aging, I think is really, really critical. I think there are policy changes around financial planning and savings. They're really important, making sure people have health savings accounts so that they can make sure they can pay for the health costs that they're going to have ongoing. And I think, continuing to kind of beat the drum on those is what we need to be doing. And I think as we're doing that, it's how we change those conversations and get great advocates like all of you kind of on board to help us with that. So there's still a lot that needs to be done.
No, thank you very much for that. And again, just a big thank you for everyone joining this Global Cafe session. Now, Melissa, we usually conclude our sessions with a few key takeaways from you as the expert speaker on the discussions had today. And to allow you some thoughts, to allow you some time to collect your thoughts on a few key takeaways, I would love to show everyone next week's Global Cafe session and speaker. So next week is a very special Global Cafe. I encourage everyone to join the discussion with Dr. Jane Barrett from the International Federation on Aging on the topic of working on the edge, pushing boundaries, and challenging the status quo. This is going to be a phenomenal discussion with an incredible speaker and moderator as well. So thanks everyone, and I hope to see you all next week for this great session. But back to you, Melissa, perhaps just a few key takeaways to really share with us all today on today's session.
Oh, that's going to be a great session. I love Jane. She's so wonderful. I'll try to tune into that one. Yeah, I think in terms of takeaways and kind of what our theme was today, kind of reflecting on Silver Economy Forum. And I'm just so pleased that we can bring you all the content, that you can watch the content online. It wasn't just one point in time. It really is about, how we collaborate together. And I think that's the most important thing. So when our agendas align and when we pull together the unique strengths of different sectors and different disciplines, that's when we make those changes happen. And so when a financial services company can communicate on what's happening within the health field, or when the technology field can learn about what's happening in marketing for, e-readers. Those types of things I think are essential. And so we want to continue to be kind of the conduit of those conversations that lend towards collaboration. So my goal is that in the next, year or so, or hopefully in the lead up to the next Silver Economy Forum, if we can pull it off, that we'll be able to report on, real collaborations and partnerships that happened from December 6th and 7th. And I think really focusing in on how we can keep people as healthy as possible for as long as possible, because we know that leads to economic growth and productivity. I think, that's kind of the central message that we want to get across. And then we can help change hearts and minds as we continue to do that and change the perception of what it means to be older and to make it aspirational. Because again, aging is for all ages.
Yeah, no, thank you very much for that, Melissa. And thank you again for joining very last minute on our Global Cafe session. It was such a great session. I learned a lot, and we'll be sure to have Nancy in on another session in the new year. A big thank you to everyone who joined and the IFA team who helps run the session, but also every session, particularly Ms. Berenice Anaya. Hope everyone has a great weekend. Happy Friday, and see you all next week. Thank you, everyone.